One of the things I would like to highlight is that Omicron is a natural vaccine. And what that means is that Omicron is now going to spread throughout our population, and it's going to find everyone who is vulnerable because of either waning immunity or unvaccinated status. And what's going to happen is they're going to get Omicron. Now, if you are, first of all, it's milder. But if you're unvaccinated, that's still difficult. So it will still send you at some numbers to the hospital. At some numbers, unfortunately, it will kill a few of our kababayans. But for those of us who are vaccinated and boosted, if we get Omicron, Omicron actually acts like another booster, a natural vaccine. And this is data that was published a few days ago. And what you can see here in the middle for gray is antibody levels induced by vaccination. And what you can see on the left and the right, these are two people who survived an Omicron infection, OP1 or Omicron patient 1 and Omicron patient 2. And what you can see is that the Omicron infection actually gave them antibodies that protected them not only against Omicron, but against Delta, Gamma, Beta, Alpha. And the D614G is one of the earliest variants, the variant from 2020, the June, July, August surge in the Philippines. And so it protects against all variants. Now, should we expect? So this is a comparison. I compared the Delta surge in the NCR. So this is in black. And we currently have the current Delta Omicron surge. And you can see that it is rising very rapidly as compared to the Delta surge that began at the end of July last year. And this can be from two reasons. One, increased mobility and increased partying this time around. And we also have on top of that the Omicron, which is more transmissible. So those two are probably driving the surge. You can see it's relatively sharp. It's very sharp up. And the hope, of course, is that we will follow after South Africa. What will happen is that the numbers will reach so high that the virus will run out of food. Remember, if you ask the question, why does a surge go down? The surge goes down because the virus runs out of food. So as the virus rapidly increases, it's going to try to spread to everyone, and it's going to try to find as many of our kababayans who are vulnerable. Since it's spreading so rapidly, what you will expect is it will run out of food sooner. And when it runs out of food, it will begin to crash, which is why you see in Africa, South Africa, the numbers are crashing. In London, the numbers are beginning to fall, only because once it spreads like wildfire. But when all the trees are burnt, there's nowhere for it to go. So it begins to crash. And our hope and prayer is that it will last only about a month in the NCR. It's hard to know what will happen because it has to spread to the rest of the country. So what should we expect? We should expect very high numbers of COVID-19 cases. We should not be scared of these numbers. We should expect that most of these cases will be mild, and we should expect fewer hospitalizations and deaths. We should expect a very rapid increase. A lot of people are scared. We should expect this, but this is a good sign because if it goes up very quickly, and it finds all the food it can find, it will also rapidly decelerate. This is our hope. And we should not panic. We should not expect a lockdown in the NCR unless our hospitals become overwhelmed. And this is really important because a lot of people are going to see the large numbers and they're going to want to lock down. But since most in pandemic management, we are trying to save lives, and to do this, we have to protect our hospitals. So if our hospitals are not overwhelmed, especially in the ICU, then we do not need to lock down. We have to do granular lockdowns. We need to suppress mobility, which we are trying to do, but there is no need for the kind of lockdowns that we experienced in the past. Now, to protect our hospitals, we should expect to stay at home when we get sick. Now, one of the things that is so striking comparing the American experience and the Filipino experience is Filipinos go to the hospital for anything, and they expect to stay in the hospital for a long period of time. And in the United States and in the global north, you go to the hospital, even if you have heart surgery, after 2 days, you go home. And one of the things we have to have a change our mindset for Omicron is that if we are sick, we should expect to stay at home, consult our doctors remotely, especially if we are vaccinated and boosted, because the chances of us developing severe COVID is quite light. And then finally, we should expect significant population protection after the Omicron wave passes. So once the Omicron wave passes, it should basically booster everybody who it infects, and it should vaccinate everyone who was not vaccinated before. So significant population protection. Now, what should we do to protect our families? We should be vaccinated and boosted, especially to protect our children. We should wear masks, and preferably a medical grade mask, because we now know that Omicron is more transmissible. So the better the mask, the better the protection. We should observe all minimum public health standards, avoid crowded areas, especially indoors. And we should try to work at home and stay at home as best as we can, especially as the surge goes up. So as the surge goes up and the virus is looking for food, we want to stay at home. And if we have symptoms, we should get tested, and we should isolate ourselves if we are positive. Now, how do we adapt to Omicron? So these are questions I want to raise to adapt to Omicron. Should we shorten the time of isolation and quarantine for Omicron patients and close contacts? Because we know that Omicron has a shorter incubation period than previous variants, especially if you are vaccinated and boosted. This will be important because what you will see is that Omicron's impact on society is not from sick people, but from absent people. And so you can see that in the United States, there are not enough police officers, not enough teachers, not enough people in the private sector, because everyone is at home, everyone is isolated and quarantined because either they have COVID or they have been in close contact. So you have to ask that, what is the balance between what we can do in terms of shortening the time of isolation and quarantine, adding on that a rapid test to make sure that we do not have enough viral load in our respiratory system to transmit, right? So if we are test negative on a rapid antigen test, our rapid antigen test actually detects the amount of virus in your upper respiratory system. So if you're negative there, then it suggests that you will probably be not transmissible. Should we shorten the confinement period for Omicron patients in our hospitals? As I showed you, even for our lolos and lolas, the median confinement period in the United Kingdom is 5 days. And we are so used to thinking about 21 days as a confinement period. And then we adapt the alert level criteria for the country to deal with the mildness of Omicron. In other words, we should focus primarily on hospitals, not just on cases. I know people will be scared about cases, but the most important thing that we have done for 22 months is to protect our hospitals, and we have to do that. Now, we have to realize that Omicron is the beginning of the end of the pandemic, because Omicron is going to provide the kind of population immunity that should stabilize our societies and that should allow us to reopen after Omicron has begun. This is the hope and the prayer. Omicron is actually a blessing. It will be hard for 1 month, but afterwards it should be a blessing, because it should provide the population protection that we need everywhere.